Freckles and Lentigines. So here you can remember few points which I will try to highlight. So in Lentigines, remember the melanocyte number is increased. This is important. This is important. And one more thing which you need to remember is the lentigines can affect sun exposed and also the sun protected areas. So these two are the important points which you can remember related to lentigines, along with, of course, the disease, the condition in which lentigines can be seen is called as Peutz-Jeghers syndrome. Peutz-Jeghers syndrome. Peutz-Jeghers syndrome. Whereas freckles, F for freckles. So F for photo-exposed areas. Photo-exposed areas is wherever sun rays can fall. Sun rays can fall. Photo-exposed areas, we can see freckles. Lentigines can affect even the sun-protected sites. So sun photo-exposed areas are face, neck, and over the dorsum of the hands. Okay. Whereas lentigines can even affect the part which is covered by the clothes. Even the trunk also can be affected in lentiginosis. So L for lentigines and L for large surface area involvement. Body surface area can be affected. Okay, and in freckles, you can remember xeroderma pigmentosum is a disease in which we can see freckles. So in this picture, you can see that lentigines. So here, this is a normal, this is a normal, this is a freckles, and this is a lentigines. So if you observe carefully, the normal and in the freckles, normal skin and in the freckles, the number of the melanocytes, M1, this is M2. In a given part of the skin, the number of melanocytes will be same in normal skin and freckles, whereas in the lentigine, you can see there are 3 melanocytes, 1, 2, and 3. So the number of the melanocytes will be increased in lentigines. That is the point which you can remember with this image. Lentigines, number of melanocytes will increase. So in this image, you can see who is this Hollywood actress. Can you put your answer in the chat section? Yes. So lentigines and freckles, they are hyperpigmented macules. So I have not told you till now. So what are they? So if you look at this image carefully, there are multiple, okay, we'll draw with black, multiple hyperpigmented macules present over the face. Over the face. These are called as freckles. Okay. And at the same time, on the right hand side, you can see in the lentiginosis, there are multiple, almost involving entire back. Hyperpigmented macules are present. So these are lentigines. Okay. And you can see the lentigines can not only involve the skin, but also mucosa can be affected. And can anyone tell me what is the syndrome where you can see these lentigines over the mucosa and over the body you are able to see these lentigines? Wonderful. It is Peutz-Jeghers syndrome. It is autosomal dominantly inherited condition and it is characterized by mucosal lentigines. And this is the important point from surgical point of view. Gastrointestinal polyps can be seen in this condition. And most common site for the polyps is jejunum. So Kush, how to differentiate in the pic? So in the picture, whenever they give you hyperpigmented macules, they will give you face having hyperpigmented macules if they want the answer to be freckles. But if they want the answer to be lentiginosis, they will give you these sun protected areas having hyperpigmented macules. Okay, that is what you can remember.